I am Scott. If you're watching this video, more than likely you're suffering from severe allergies or any sort of inflammation or sinus polyps, like I have in the past. And my objective in this video is to help find some homemade solutions to relieve some of those symptoms, especially if some of y'all can't afford to go to a doctor, which I've seen in some of the support groups. My objective is to help give some advice and different things to get over some of those bad symptoms. I'm not very good at talking in front of an audience or in front of a camera, so bear with me. I have a lot of this already written down. I'm going to be reading through most of the video, so hopefully, though, you could take something with you that can help give you some relief. Now, I did want to start. I did look for some allergy jokes, but I could not find any, so I found a few food jokes. I am very fond of cold coffee, frappuccinos, especially at Starbucks. I know many of y'all are too. So these are pretty lame jokes, and I did make up a couple. But what do you call coffee in a car? Carfy. What do you call coffee in an office setting? Brake fluid. You liked that one, didn't you? I know, I did too. Drinking too much coffee can cause latte problems. Anyways, sinus polyps are awful. They affect 2% of the population at some point in their lifetime. Before you take my advice, you probably want to know how well my method worked for me. It started in, remember, May of 2008. I was living in an old garage apartment. I'm not sure the condition of how the sanitation of it was, since of the garage, since I never went down below it, but more than likely it had different mold problems. I'd noticed the bathroom floor was sort of slanted, which kind of hinted that maybe it had some sort of water damage, and any sort of water damage more than likely is a result of mold problems. But I didn't think about that back then. That does affect the sanitation of the air, and my allergies are more airborne onset than with food. And I did want to talk about how both of those affect allergies here in a minute. But I didn't think about how often I needed to dust or vacuum, and how dry the climate was that I was living in, especially in the wintertime. Most people's allergies are worse in the wintertime because the dry climate, our sinus cavities needs a certain amount of humidity in the air to actually be feeling well. So anyways, right now, I mean, back then it was blocked 100%. I couldn't smell or taste. I had all this pressure going up down below my eyes, up into my forehead, and it hurt constantly. It would throb, and sometimes even like my eyes would hurt. And I'm sure some of y'all have experienced that too. I'm to the point now where I'd say I'm only 10% blocked most of the time, with very little prescription drug use. If you're wondering what sinus polyps are, essentially they are tumors that are non-cancerous in the sinus cavities. Doctors don't know what causes them, and there isn't a cure. There are many things that causes the membranes of the linings of the sinuses to swell, and these affect the size of the polyps. Inflammation of these membranes can cause polyps to expand. Inflammation is not the enemy that needs something to suppress it. It is the body's response to addressing an immune deficiency against allergens. Medications of today restrict these symptoms in the short term, but at the same time suppress our immune system, yielding no long benefits to many dangerous side effects. Polyps can be affected by food allergens. Not only can wrong foods contribute to allergic reactions that cause polyps to swell, but not getting the right nutrients can lead to an already weak immune systems to double back and cause even more inflammation. Air allergens. The sanitation of your home and work environment are very important. If you're in an old building with mold and asbestos hiding in the structure, change your air filters, dust, and vacuum as often as possible. And climate is also another contributing factor. Cold and dry air are much more abrasive to the sinus lining than warm and humid air. Try a humidifier if you are in a dry climate. Pollen season in the spring can be a challenge if you don't want to wear a dust mask all the time. And I would suggest wearing a dust mask if you're mowing or doing yard work. I do that, and no one's going to look at you crazy like I thought they would. It's, most of us have to just wear a dust mask, and not necessarily when there's a epidemic breaking out, but allergies can definitely be a reason of its own. I would not suggest wearing them to a family gathering, though. You may get some weird looks then. If the average person has allergy problems during this time, it is more than likely won't go smooth sailing if you're a polyp sufferer. Genetic disposition is something we're probably all prone to because it is hereditary. If you don't have to throw in the towel and say that you're going to be miserable for the rest of your life, there are alternative routes that you can take in the medical field if lifestyle changes don't help it. Some ENTs will refer you to an allergy clinic and will start immunotherapy. It is common taken in shots and sublingual drops. This was the very first route that my ENT took with me. Instead of prescribing a bunch of drugs, I think they did a couple of times, antihistamines, and one, I can't remember the names of them. Didn't really help very much, so they said, okay, you could either come in once or twice a week for a shot, and it was about a 30-minute trip, or you can start taking these sublingual drops, and somehow they would find out through an allergy test what you're allergic to, and somehow combine it into a liquid form, and you would pump a couple drops under your tongue 2 or 3 times a day for however so long. I don't know the exact cost of it, but it was fairly expensive. I did it for about a year, and I did not see any results whatsoever. So it may help for some people, and I definitely would not want to exclude that since it didn't work with me. But it's definitely an option. I mean, I would definitely suggest it if you're able to go into a doctor's office. I would definitely try it. The very first thing you should know before you try to find a route to relief is you need to know allergic to NSAIDs. It stands for non-steroidal anti-inflammatory drug. This includes drugs such as ibuprofen, naproxen, and mainly aspirin. The main ingredient aspirin is salicylic acid, also known as salicylate, which is composed of all NSAIDs. Not all, but a majority of sinus polyp sufferers have an allergic to this. Salicylates are found in 2 forms: synthetic, which are preservative agents in moistures, soaps, detergents, and antacids, and natural. The skin of fruits and vegetables is also as a natural pesticide. And there are 2 different routes you can take regarding to this. I went on a salicylate-free diet, not knowing whether or not I was allergic to it. A simple way you know if you are allergic to it is just to take an aspirin or a naproxen or drink Pepto-Bismol. That actually has it, and you'll see whether or not you have an allergic reaction. It'll swell up, you may break out in hives. I would suggest very little if you did want to do outside of any sort of hospital supervision, which hospital supervision is definitely recommended. If you take it and you do find out that you are allergic, you can either go on an elimination diet and eat foods low in salicylates. I don't have the direct link to it, but there are just Google salicylate in foods, and you'll find different tables to show how much salicylate is in each one. And I did this, and I was absolutely miserable on that diet. It excluded 15-20%. I could only eat 15-20% of foods out there. 80% had a good amount of salicylate in it, so it's very rough road. I ordered expensive detergents, soaps, dryer sheets. I mean, you name it. I almost go as far as buying soap for a car, but no, that's it's not going to really get on your body. But all right, the second option is to, if you can't stay away from it, which most usually can't, is to go through aspirin desensitization by taking large amounts under hospital supervision. The body reportedly builds a resistance to it, but large quantities of aspirin must be taken for one time period if you want to be resistant to it. I personally would advise against this, not only because the risk of a deadly allergic reaction, but the dangers of NSAIDs in general. NSAIDs are linked to many deaths, includes cardiovascular problems, gastrointestinal bleeding, ulcers, kidney failure, increased blood pressure, and heart disease. If you are not allergic to salivate like myself, move to a warmer climate or use a humidifier, inspect for mold and asbestos in structure of older buildings, keep area dusted and vacuumed as much as possible, and eat the right foods and drop the bad foods. While trying to find the right diet, many of you want to consider dropping all dairy because many people who have allergies have experienced relief when excluding this category. The next one might be tough for many people because it is included in so many different things. Drop bread. When you hear the words gluten-free, it means excluding wheat, barley, and rye. While many with celiac disease suffer from inflammation in the intestines, allergies can be elevated for many people when this is restricted. I can't give up cereal, and I did try to do the Atkins diet for a while, which Atkins diet is pretty much high in fats and proteins, low in sugars, and low in carbohydrates. Sugars is essentially toxic to the body if you think about it. I mean, lots of different diseases related to. First of all, you got diabetes. That's most of America is already suffering from some sort of type of that, and a lot of sugars are in areas that we just not really even thought about. Most of our cereal, it says, oh, look, it's honey bunches of oats. It has whole grain. That's going to be really good for you. If you look at the sugars, it's like 20, 30 grams per cup. And that's just not really healthy. That's probably, if you think back in 1920s and 30s, that'd be an entire day's worth of sugar for one person. Sugar substitutes, that's definitely debatable on when to use substitutes. I use it personally in my sweet tea. And that's, I use Splenda. And you do have the debate of, the chemicals in it can be dangerous for you too. And there's, everything out there pretty much causes cancer. We could definitely go down that route. But restricting sugars I honestly feel will help a lot of people. I would suggest fruits and vegetables be 75 to 8% of the diet, with vegetables being 60%. They contain the nutrients to increase white blood cell count, which is a need to divert allergic reactions. Now, there are things you can add to your foods that can definitely help. You can add some spices. They have anti-inflammatory agents that can help without the use of NSAIDs. Cloves, ginger, which can come in capsules, turmeric, which also can come in capsules. I would not suggest powdering this all over your foods and stuff. If you've taken a bite of ginger root, you will probably know what I'm talking about. I tried to blend that in my smoothie, and it does not blend very well in a blender. Ginger root does not blend very well in a blender. If you have a juicer, you could probably do it. But you will definitely find a surprise if you try that. Rosemary, which I have not tried, and cinnamon. Cinnamon goes well with so many different things. I call it my natural sweetener pretty much. It's definitely a safe, good alternative to sugar, although it definitely has a pleasant taste to it. Other foods that boost immune systems, fish, and sort of fish products. So it has omega-3 fatty acids. It helps to fight. It's vital to fight inflammation. Any leafy greens is full of antioxidants. Blueberries, tea. You can drink it. I would not suggest eating tea. And garlic. There's the vitamins to supplement selenium, omega-3 capsules, and you can also get a good amount of omega-3 in and chia seeds. And chia seeds is dissolvable seeds that actually you can put any sort of your drinks, and it doesn't necessarily affect the taste, but you can get a huge amount of omega-3 in it, and it's very good for you. And vitamin D. Most people are deficient on vitamin D, and it's a very important vitamin to have. So if you can't, that's definitely, I don't know exactly how that affects allergies, but it definitely can help your overall well-being. Some potent drinks that are extremely healthy for you: Bragg's apple cider vinegar diluted in water. I add local honey and maple syrup and cinnamon to mine. I don't actually add maple syrup was something I saw that was suggested, but honey and cinnamon is definitely something I make with mine. I just mix it up. You basically want to put enough water, dilute it enough with water. You don't want to drink apple cider vinegar straights. That is not suggested. It is very bad for your teeth. So brush your teeth after drinking apple cider vinegar because it can eat the enamel off of it. Horseradish and local honey. I tried horseradish sauce and it was absolutely terrible. You can mix that with honey, and if it's something they can deal with, then definitely be about it. That's some of the old remedies. I was seeing some of those remedy books that had horseradish in it. I tried a little bit, and it's just an extremely it's really spicy spice that I don't really care to deal with. Eliminate as many processed foods as possible. These are foods such as flavored chips, soda, TV dinners, which I'm guilty of. I love Hot Pockets, and I love pizza rolls. And I love Dr. Pepper. I mean, that's just like the perfect week, and I may feel terrible afterwards, but while I'm eating those, it's just amazing. Freezer snacks and deli meats. They have dangerous chemicals that uses preservatives, not to mention an unhealthy amount of soda. Yeah. Some different foods to pick up when you're at the store. The produce aisle is definitely the best place to go. Anywhere where there's boxed anything like in the middle of the aisles is usually the boxes and stuff that can stay on the shelf forever. That's usually not the best stuff for you. Fruits, vegetables, whole grains, not gluten sensitive. And I cannot give up cereal. I have not gone completely gluten free. I don't know if I ever could. I may need some help in that area. Dairy substitutes such as soy and almond milk. That's definitely, if you can't give up cereal like I would suggest soy milk. A lot of people out there drink almond milk, but I just don't like the particular taste of almonds. There's different vegan substitutes for cheese. You don't have to necessarily go completely vegan. I wouldn't think that eating certain meats would trigger a bad allergic reaction. Eating too much meats definitely can't be good for you though. But if it is, and of course tea. If it is colorful and spoils quickly, chances are it's good for your health. All natural diets are the most fail-safe diets because they can be long-term or for a lifetime. If losing weight is a result, I'm losing weight as a result of making diet to lower my cholesterol. It also helps my polyps, keep my polyps under control. There are different sinus rinses that you could use. Neti Polyps, definitely a very common one. Uses different saline patches, which is completely natural and safe for your sinuses. I use a Neilmed bottle. It's more of a squeeze bottle. It's a little different from the Neti Pot. It's similar, but it uses pressure, a squeeze bottle that's not only rinses the frontal sinuses, but pressures the stream to reach the very back of your sinuses. I dilute alkalol and distilled water and use it with this bottle. It has all natural oils and neutralizes pathogens commonly found in infections. Alkalol can be found in Walgreens, CVS, and Amazon. I buy Yields worth and rinse daily. It does. Alkalol it's very powerful. It stings a little bit, but once you rinse, it just feels fresh. It makes your sinuses feel good. I would not suggest rinsing right before bed because it's not all completely drained out of your sinuses. It can kind of dry out some different parts of your sinuses and in your eyes as well. If you wake up and your eyes are really, really dry, you can either use any sort of eye drops to remedy that. Stay away from nasal sprays that are listed as decongestants. ENTs do not stress the dangers of these enough, and these are extremely addictive. The first one is oxymetazoline. These are different ingredients on the back of different nasal sprays such as Aspirin. Phenylphedrin is also another one. There's an instant reaction once you spray those. They restrict your blood vessels. Not only are these addictive, but they're dangerous in bursting the blood vessels around the eyes and in our sinuses. And they can cause eye problems. Even when you go to an eye checkup, go to the optometrist, ask them about decongestant sprays and how dangerous they are. They'll especially agree that not only are they addictive, but they're extremely dangerous for you. So please stay away from it if all possible. I would suggest prescription drugs if your polyps are causing you misery. Hopefully you have tried natural remedies and diets beforehand. Prescription drugs are not meant to be a long-term treatments and can cause serious side effects. Some of the highly recommended prescription by sufferers are Q-Nasal, Betnasol M, Diamista, and Flonase. Discount coupons can be found in some of their websites and make them a little less expensive as they already are. Surgery is also effective in some cases. However, many times they return as they were. It happened with me in both surgeries that I had. Within weeks after I was blocked just as before. There are risks of losing your sight and hearing, so you want to be sure to find a very experienced and recommended surgeon. Although I'm skeptical that there is a cure out there, in which case I have to pay large sums of money just only to hear what we have already discussed. But there are ways to keep polyps under control and bearable for as long as our bodies decides to keep them. The real question is, are you willing to experiment with lifestyle changes in order to find relief? Hopefully, this gives you some ideas on ways to find relief and live a great life.